Thank you, Zouera, for taking the time out to join us today.
Of course, Esther. Thank you for having me.
So we're talking malnutrition, and it's a very tricky subject. And I'm just, when one thinks about how widespread it is, not just in Nigeria, but on the African continent, it can be quite disheartening. But let's talk about Nigeria. Nigeria has one of the highest levels of malnutrition. How did we get there in the first place?
So we've ended up now with 11 million chronically malnourished kids. We have 2.5 million of those who are severely and acutely malnourished. Those are the children that are literally on the brink of death. We have 2.5 million of those. It's a mix between poverty, and it's been exacerbated, of course, by the displacement that we've seen over the past few years. But even absent,
the militant, the Boko Haram situation?
Exactly.
In the north?
So that's made it a lot worse. So imagine if people run away and they end up away from home, away from their normal means of livelihood. The reality is their ability to take care of themselves and feed their kids is reduced. So we have even more malnourished children now. The real problem that we have is that all the big challenge is that the first 1,000 days of our lives are the critical part of our whole future. Depends on these first 1,000 days. First 1,000 days is from conception until our second birthday. So what needs to happen between when we're conceived and when we're 2 is that the mother has the appropriate diet, so has the right vitamins, the right nutritious foods, etc. And then when the baby's born, the baby now is exclusively breastfed for the first 6 months, and then has the appropriate, transitionary feeding. And then by the time they're 2, they've had all the right nutrients and the right food and the right calories, so that by the time they're 2, their brain is fully formed. What happens with a child who is malnourished chronically is that your brain doesn't develop all the connections inside. They're called synapses. And so your brain will never be what it was meant to be. And by the time you're stunted at 2, this condition is irreversible. Now also, think about the generational part of it, right? So a mother or a young girl who is malnourished, she'll eventually grow up if she survives. She'll have most likely a malnourished child, and then the cycle continues, right? This whole trifecta of poverty, disease, and ignorance. And so we've ended up with a current stock today of 11 million chronically malnourished children. Very unfortunately, most of them in the northern part of the country. And early marriage doesn't help, lack of focus on adolescent girls doesn't help, lack of the appropriate support for mothers while they're pregnant also doesn't help. So all these are the factors that have led us here now.
And these are for ages from 0 to 2 or under 5?
Yeah, so the under 5 is what we're counting. So really, we say under 5, the #1 cause of mortality in Nigeria of children under 5 is related to malnutrition. So whether children are dying of malaria, of diarrhea, of pneumonia, the underlying reason that kills them is malnutrition. So if you're malnourished, you're much less likely to survive malaria, much less likely to survive something as simple as diarrhea. This is how we lose so many of our children every year.
I'm a little puzzled because how we were able to get to where Nigeria is now being referred to as a country that has the highest, or one of the highest numbers of malnourished children. I know that over the last decade or so, they're usually, the likes of the Red Cross, civil society organizations, NGOs who specialize in, helping the maternal nutrition and all of that. So I'm thinking all those efforts, haven't they helped reduce or have some kind of impact at least?
They've had an impact. A lot of the big donors in the malnutrition space, so the UNICEFs and the DFIDs and the USAID, all these organizations, CIF, Children's Investment Fund, have spent a lot of money trying to combat severe and acute malnutrition. What we find, though, is that their ability to hit the problem completely is not there. So what we found is that about 90% of the children who need RUTF in Nigeria, RUTF is ready-to-use therapeutic food. This is a peanut-based, groundnut-based, a very high-protein, high-calorie food that children who are severely malnourished get, and that helps them come back to life. Only 10% of the children who need RUTF actually get it. Why? Because the donors don't only have Nigeria as a priority. Our problem is absolute numbers, right? We have the most We're the most populated country in Africa, so of course, you know, when we have a big problem here, it's bigger than
so
than
it
in other
takes
places.
it would take a lot more to have that.
It takes a lot more, and that's what's led us to want to have an intervention in this space. Let's take care of the children who are severely and acutely malnourished now. Let's go in and help get this RUTF for these children who are dying. Make sure that the community management of acute malnutrition is sorted. And at the same time, let's add a capacity for their families to improve their livelihood. I mean, obviously, a child who ends up in this severely, acutely malnourished state, that's a proxy for an extremely poor family, right? We know that something is going on at home, that the parents aren't able to take care of the child appropriately. So imagine if all we did was take care of that particular baby, we give them the RUTF, and then they go back home in the same condition, same family that produced them. It's obvious that in the next few months, these same children will come back. So we've had a very high recidivism rate of, you know, children being treated, but then they come back. We're trying to break that by making sure that the parents also have access to livelihood programs so they can do little farming, little businesses to help them increase their ability to generate an income for themselves so they can have proper food for their kids.
Okay, so the Dangote Foundation is putting on the table $100 million over the next 5 years. But let me ask you first, why is this malnutrition, this issue, why is it so special?
So we really believe that this is a basic building block of life. If we are not able to intervene and save our children and give them a chance to be productive citizens by the time they're 2, then whatever effort we do afterwards is a little bit moot. So we can talk about, you know, vaccinating children, we can talk about sending them to school, but if their brains are already stunted by the time they're 2, then that is pretty pointless. So let's attack the basics of the problem. If the brain is not ready to absorb all the information that a child needs in their lifetime, then half of the work is not going to be helpful. So this is why we're really focusing on this. It started off with, you know, Alhaji just being extremely moved by child hunger. Like, he just couldn't stand seeing, you know, starving children. And so that's why we have this big feeding program that we do in Kano, which feeds 12,000 people a day. And this program has been ongoing for 30 years or so. I mean, it's been going on for a long time. But it's not just to feed the people. Well, how do we make sure that they stop coming to the feeding centers and they're able to take care of themselves? And then we started looking at the science behind nutrition. Well, what does it really even mean? And this is when we, you know, started looking at things like stunting and brain development and cognitive ability, and found a whole community of other people trying to do the same thing, and decided this is what we really have to do. And as Africans focused on empowering other Africans, this is what we need to do to make sure that whatever investments we make going forward are actually productive.
Okay, so I'm just thinking, for the next 5 years, $100 million, that's a lot of money. How is this money going to be dispersed in terms of, are there special projects, what are the targeted areas?
Okay, so we're going to be running a program called ADFIN, Aliko Dangote Foundation Integrated Nutrition Program. The integrated part is the part where I told you about the livelihoods program for the families, right? So we're targeting 1 million children that we will get out of this severe and acute malnourished state over the next 5 years. That's our goal, to reduce this prevalence of malnutrition in our country. How it's going to work is we have partners that we will be granting money to go and implement this community management of acute malnutrition. It's called CMAM, across the north. In addition to that, we will be partnering with UNICEF to help them get the RUTF for us. We're looking at, there's one company in Nigeria, we finally have locally produced RUTF. We used to not have that. So we're going to be buying from them, and we will be also looking at setting up supporting other locally produced RUTF. The goal is to not only help the children, but also empower organizations, businesses, NGOs, like all the network that we need to help us deliver this program is what we will put into motion. So we'll be working with partners. We've already identified them. And we'll be launching this program in the next couple of days.
So I'm just thinking, is this something, even though it's a lot of money, but I'm just thinking, because you also said that you're hoping to reduce malnutrition by at least 60%. At the end of it all, is it going to be a situation where people, they would have benefited so much from it that they would be self-sufficient in a way that they are able to I'm just hoping, am I being too...
That's the dream. That's the dream.
Yeah.
That's the dream. $100 million is a lot of money. It's more money than any African donor has ever invested in this particular space, but it's still not enough. It's not enough. Remember, I'm telling you that right now we have 2.5 million children who are suffering from this. $100 million will help us get to 1 million of them. That means we still have more children out there that will need us. Now, what we also want is to encourage others to join us in this fight. We can't be the only ones. We know we don't have enough resources to do everything by ourselves.
How about significantly empowering the parents, maybe especially the mothers, to be economically independent so that they can continue?
Exactly. So that's the big difference between our program and the traditional CMAM programs. Is that traditionally, you treat the child gets better, you send them back into the community. Our program is you treat the child, but you also work with the mother in particular. I say the parents, but really the mothers, if we're being honest, to help them come up with a livelihood improvement program. That's everything from small-scale dairy, poultry farming, a small vegetable garden, teaching them about infant and young child feeding practices. We have a lot of practices that aren't good. For instance, we all understand in Nigeria that breastfeeding is important, that most mothers breastfeed. But the exclusive breastfeeding rate, meaning that you only give your baby breast milk from when they're born until they're 6 months, in Nigeria we're at 17%. That's really low. And this is a big problem that encourages children to become malnourished, because if you give them something that their organism isn't ready to deal with, it reduces the impact of their mother's breast milk on their bodies. And so it's important that we have a behavior change component, meaning teaching people about the importance of exclusive breastfeeding, talking to parents about proper child feeding practices, talking to moms about, helping them come up with an income generating activity so they can do a better job of taking care of their children.
We'll continue our conversation right after the break. See you in a bit. Welcome back to Beyond Markets as we continue our focus on ways to combat malnutrition in Africa. Let's talk about the recent summit on where a number of world leaders, CSOs, NGOs came together to talk about and create more awareness around global malnutrition. And it's global, it's not just an Africa problem, but unfortunately Africa is usually the focus because that's where we usually have the highest numbers. What was your experience in terms of the body language from the leaders and the level of commitment you sensed?
Okay. So it was a really interesting summit because different countries have different nutrition problems, right? Like some people are talking about obesity and children that are overfed, and all I could think of is, yeah, we have a few overweight kids in Nigeria, but that's not where our problem really is at this point. It was very interesting to see I'm not going to call it disbelief, but the amazement from a lot of traditional Western organizations that there was an African organization willing to make such a big commitment and step out so forcefully against malnutrition. I think this idea that donors and NGOs and supporters are always coming from the West, this is one of the notions that we're trying to dispel at the Dangote Foundation, because the reality is Africans are about empowering ourselves, and how do we make sure that we are also participating in solving our own problems rather than always expecting somebody to come and help us. The other thing is we're here, we're not going anywhere, right? The Dangote Foundation is a Nigerian organization based in Nigeria. Aliko Dangote is here, he's from here. And so his focus on Nigeria and on Africa is permanent, as opposed to an organization that has a yearly funding cycle, and then the winds change, and now they're looking at different countries, and now other places take the focus. So it was really interesting to be in a context where we were the only African organization making a pledge. We were the only ones committing real money to this fight against malnutrition and focusing on ourselves. And so yes, even if the debate around and the problems around nutrition are about cities and how we're going to feed ourselves in the future, and agribusiness and creating jobs in agriculture and non-communicable diseases and overweight and heart disease, yes, but we also have a very basic problem here, which is we have too many people who simply don't have enough calories every day to live. So that's what we're looking to fix.
Do you think it's possible that because maybe for over the decades we've relied, many African countries have relied so much on Western aid that it's become a thing of perhaps we need this to continue, and that's why when we prioritize malnutrition and putting money into things like that, we don't feel the need to, because we feel like it's something that automatically should come from Western donors?
Well, I mean, unfortunately, I think our reliance on donors is historic, but I really do think that things are changing because the realization that we're not necessarily on the same priority path as the people trying to help us. So we need to be using our resources in a way that is beneficial for us. A lot of the programs, for instance, that I see us doing here in Nigeria, that I see the federal government doing, like the school feeding program, that's fantastic. We should totally do the school feeding program. But school feeding is not going to solve the malnutrition at that 0 to 2 age that I'm talking about, because we're talking about children who are already in school. What we need to do is make sure that more children are able to even go to school and pay attention and understand and learn. So the effort should also be before. So yes, we need to do the school feeding, which by the way is an educational program, not a nutrition program, but making sure that mothers have the right support prenatally, that they're not having these babies too early, and that the children have what they need as they grow, so that we have brains that are developed, that are powerful, that can change the world. We're not going to be making a lot of progress if we have yet another generation of millions of stunted children in Nigeria, because that means that all that productivity will be lost for Nigeria. So we need to feed their brains when they're little, so that by the time they turn 2 and 3 and 4 and start school, that they're able to absorb what they're being taught, and that they can now grow up to be productive Nigerians. I
want to quickly take you back to that summit again, because there were quite a number of African leaders there. Did you get the sense that, the sense of a higher level of commitment, or wanting to prioritize differently this time, more to fighting malnutrition?
Yes, I have to say the First Lady of Ethiopia was there and made very strong commitments. They have a strong target for reducing stunting in their country. That is a government-led target that everybody is following. Côte d'Ivoire was there with a commitment. Niger Republic, my actual country, were there also with a commitment. Madagascar, which is struggling with a big malnutrition problem, were also there talking about how they're going to take all these different steps to make sure that malnutrition is raised at a higher level of consciousness inside of their countries. But at the end of the day, it's not necessarily about putting in more money. It's about reorienting some of our resources into things that are really important, because, even if we take part of the resources that are already allocated to, say, the Ministry of Health, the Ministry of Education, Ministry of Infrastructure, and use that to make sure that mothers and children have access to the appropriate prenatal vitamins, support, etc., then the problem will be definitely reduced. So part of our job is also to raise awareness. Yes, we're investing a lot of money. We want to put our money where our mouth is, but at the same time, we also want to use Anaja Aliko's voice as advocacy. Like, look, I'm putting in this much money. So these different states where we have huge numbers of stunted children, we also need you to do your part. So it's also an awareness raising advocacy work that we'll be doing.
I've heard a lot about donor fatigue, and I've heard that as Africa, because we're also part of this, the new age of technology, we're also moving, as the world moves, and I've heard a lot of talk about donor fatigue across, different sectors where aid is concerned. Do you see that also happening in this fair, and do you think that perhaps that is more reason why we should actually begin to step up, and are you hopeful that we can take advantage of that as well?
Absolutely, Esther. Donor fatigue is real. If you think about where the donors get their money from, they get it from their own taxpayers. So the people who contribute to DFID's money are British citizens who have their own problems and their own dissatisfaction with how things are going in their country. The places like Germany, right? They have their own problems with the migrants, and think about all the problems that we watch on the news every day that the countries that are donors are struggling with, right? The US. So if we're waiting for them to help us, then all we're doing is delaying the day when we actually have to step up and start doing things for ourselves. So the quicker we can get on it, the quicker we can handle our own problems and do our best to reduce the suffering of our fellow citizens, I think the better off we'll be, because donor fatigue is real. People are struggling. ODA budgets have been reduced dramatically, and I don't see that changing anytime soon.
And let's talk about the primary healthcare at primary healthcare level, especially here in Nigeria. You talked about maybe ways in which the government could help support giving necessary vitamins, or prenatal vitamins to the mothers to just help them help the babies that they're carrying and that are subsequently born. Do you see that level? And I know that many of this problem is predominant in the Northeast, where there are high poverty levels. Is this something? Do you see any kind of support? Is it?
Yes, no, absolutely. Even in Kano, for instance, Kano State, where we have a tripartite agreement with us, the Gates Foundation, and the state of Kano, we've been working for the past 3-4 years on strengthening the primary healthcare system, primarily to help fight polio and to increase the rate of immunization of children. But that same system is the same system that will also help deliver better healthcare for mothers, better nutritional support, etc. And so the extension of the MOU that we signed a few months back was exactly to do that. So the platform is already there. We've already strengthened it. We've done all this work for the past few years. Now let's use that existing system to flow through it, maternal and child care, now, because the system is already there. So we're already doing that in Kano. And that's what we're going to be looking to do across the states in which we work. Because a lot of it is awareness raising. People think of nutrition as just, and then you think about, things like when everybody has been stunted for a long time in a community, everybody now is smaller. So nobody thinks that being particularly small is a problem, because it's just how everybody is. So your levels of comparison change. So instead of the gap between a normal sized child being, here's the normal sized child, here's a stunted child, if the norm comes down to like this, then we can't even tell the difference between stunted and regular children, because most people are now stunted. That's started to become a problem. So we need to reverse this trend, and this is really an important measuring tool for us to see that children are getting bigger in the next few cycles. We should start seeing bigger children and better performance in school and better contribution, if you will, to the economy.
So this is at the end of that 5 years. You're hoping to,
yes,
when you go back to the drawing table and you look at the numbers, are you optimistic, yes, about seeing a 60% drop?
I am absolutely optimistic. I am completely optimistic, because we are going to do it. It's not just a pledge that we just said we're going to do it. It's an actual investment that we're making. So the Milan conference, the Global Nutrition Conference in Milan, is calling it a pledge, right? These are all the organizations that are pledging. It's not just a pledge that we're making, it's an actual commitment, and it's actual money that we will be spending, signing contracts and getting this done over the next few years. And God help us, but what I am confident about is that we will get these numbers up.
And you're hoping that perhaps after the 5 years, you wouldn't have to go another 100
Well, so the dream is that, it'll be so successful and people will be embracing it so much that we won't have to specifically be the ones to have to reinvest another $100 million, but rather that the whole system has changed, people understand things better, people are behaving differently, others have come into the space, and so the problem is now something that we're looking at behind us.